So it's basically a ring sitting on your finger that is made of a PVDF material. It measures mechanical movement of the arterial wall, and it basically measures the change in the circumference of the digital arteries. And by measuring that, you can look at things like vascular tone and things like vasoconstriction, vasodilation, the diameter of the arteries, and vascular resistance. And the reason why we developed this device is because right now there is no non-invasive continuous way of measuring vascular tone. And that's a very important parameter to look at when a new patient arrives at the emergency room. You don't know whether they're vasoconstricted, vasodilated, what their overall status is. If you think about it, you have the heart as a pump and blood as a fluid, and you also have the vessels, and the condition of those vessels are very important in characterizing the condition of a patient. So this is what it allows the physicians to do in a non-invasive and real-time manner. Most patients can use it unless they have a very low perfusion in their peripheries, which is what is measured by the sensor. So if you don't have circulation in your digital arteries, you won't be able to get a good reading. Other than that, so maybe very old patients with low perfusion, it would be harder to use it on them. But other than that, most patients, certainly all the patients that I've been monitoring, we were able to get a reliable reading from them. So basically, this is similar to, kind of similar to pulse ox. So this is a very crude version, obviously, that would be very different when a company produces it. But it's a ring. It would just easily goes on the finger, and there's Velcro. Yeah, extremely non-invasive compared to other things that people, like the catheters that you would have, they would have to put in for invasive measures. And then you can adjust the pressure with this screw on the top. So the waveform you see is basically showing the main beat plus the dichotic notch, which is the closure of the aortic valve. And you can also see the reflection waves in the signal. And those reflection waves can help you determine whether the patient is hypovolemic or vasoconstricted, vasodilated, and other things. Also, the amplitude of the signal would change with these events. In particular, we're trying to combine this sensor with a pulse ox. That would give us the flow information. This sensor would give us mechanical information, and the combination of two would allow us to measure or track changes in the diameter of the artery, which is directly related to vascular resistance. So we put this on animals that were, and we were drawing blood from them to simulate hemorrhage. And what we saw was that we saw a meaningful change in the morphology and the shape of the waveform from baseline to hemorrhage. And then when we resuscitated back to baseline, and then hemorrhage again, back to baseline. When we did that, we saw a meaningful change in the morphology of the signal. Basically, the reflection waves that exist in the arterial wave changes with hypovolemia or hemorrhage. And we were able to clearly see those changes in our signal. Other places that it could be potentially used is for septic patients who might experience septic shock, which is caused by extreme dilation due to release of cytokines, you can also detect that. What we're looking at right now is intradialytic hypotension, the hypotension that dialysis patients experience throughout their session. And since these patients don't have any invasive measures, the only way to detect that hypertension is by having a pressure cuff, getting readings every 5, 10, 15 minutes. And so you might lose some time if you want to wait for 5 minutes, 10 minutes, 15 minutes to get that reading. This would be a continuous measure that shows that actually the changes you see in the signal would precede changes in the blood pressure, because the vasoconstriction is the mechanism the body uses to maintain homeostasis, to maintain your blood pressure. So that would happen before actually blood pressure starts dropping. So by looking at that and by making it an objective measure, as opposed to blood pressure, which has a different baseline for different people, for different patients, you would be looking at the reaction of body to changes in the blood pressure, and your body knows better than anyone else what your normal level is. So if you see your body reacting, that means something bad is happening. I would imagine in the next 3-4 years, hopefully we would have a clinical study, and hopefully we would have some sort of device on the market. By using this device, they would be able to not only look at blood pressure and heart rate and flow, and sometimes they would have to do it invasively. With this device, they would be able to non-invasively in real time actually determine what the reaction of the body is to hemodynamic events that are happening.